Hi everyone, this is Tom Salemi of Device Talks. Welcome back to the Structural Heart Talks podcast. We built this podcast series with the fine folks at Edwards Lifesciences to really look into their singular focus on structural heart. I traveled to their headquarters in Irvine, California to meet with the senior executives who are making this transition possible. In today's episode, you'll hear from Wayne Markowitz. He is Senior Vice President of Surgical Structural Heart at Edwards Lifesciences. We talked, of course, about Edwards' surgical structural heart portfolio. We talked about Wayne's background, his work at Guidant, the culture comparison between Guidant and Edwards, and a little bit about his travel abroad. So great conversation with Wayne Markowitz. Again, he is General Manager and Senior Vice President of Surgical Structural Heart. But first, of course, we want to hear from our sponsor. Managing Editor Kayleen Brown is sitting down with our sponsor, RESILIA. Let's listen.
Andy, welcome to the podcast. Really appreciate you taking your time with us today. I want to start by talking about your current role at RESILIA and the current location and site that you're at.
I'm Andy Paganaw. I'm the Director of Strategic Projects in Bethel, Connecticut. I was part of the acquisition of Memory Corporation late last year, and I'm on the Lightspeed team.
Oh, so the Lightspeed team. Can you go into more detail? What is Lightspeed Lab? What do you do?
Lightspeed is the new product development group within RESILIA. We have dedicated resources that allow us to move really quickly, and we have really aggressive goals on quote turnaround time and prototype lead times. We're actually just setting up a new Lightspeed Lab here in Bethel, Connecticut.
So if you're setting up a new lab in Bethel, Connecticut, what is your specific specialty and the specialty of the lab?
So coming from the legacy Memory Corporation's site, from the acquisition, we're really focused on nitinol materials and nitinol medical devices. We will do everything from laser cutting, shape setting, through to conventional machining and surface finishing of nitinol components. But our specific focus in Bethel is really going to be on orthopedic implants, surgical tools, and things like that.
Well, congratulations about your new site. Can you take us through the different orthopedic applications that you work on?
Yeah, I mean, we work on tons of different applications. A lot of them are focused on extremities. So looking at bone staples, compression plates, hammer toe implants for foot and ankle, K-wires, surgical drills. And we also do a lot of things like suture anchor inserters for suture passing wires. The suture passer is actually one of the first FDA cleared nitinol implant devices. So it's been around for a while, and in Bethel, Connecticut here, we've been manufacturing those since the beginning. And these applications are rapidly expanding to other applications, for example, spine. And our customers are really seeking to utilize the unique functional properties of the nitinol material that we work with.
You have experience with nitinol very clearly since the very beginning. How do you help companies get to market faster and improve the quality of their device?
Definitely expertise and experience. So you hit that nail on the head there. We've been making bone staples, for example, for over 10 years. Suture passers and drills we've been making for over 15 years. So we really have a good understanding of the process flows. We have optimized processes for all these different types of devices. We also have a fully equipped test lab. So for helping with some regulatory submissions, we do corrosion testing, mechanical testing, and we have the ability to measure phase transformations. In upstate New York, we have our RESILIA Smart Materials site, which is one of the first commercial melters of nitinol. So we actually have the added advantage as well of looking all the way back to the starting material and what net shape, if is it a unique net shape, unique properties that we need to start with. We have that advantage as well.
Well, thanks again to our sponsor, RESILIA, for supporting this episode of the Structural Heart Talks podcast. Now let's hear my interview with Wayne Markowitz. Again, he is General Manager and Senior Vice President of Surgical Structural Heart at Edwards Lifesciences. Well, Wayne Markowitz, welcome to the podcast.
Thanks so much. Excited to be here.
Excited to hear where Edwards is heading in structural heart. It's a very, very important area in medtech and you've got a good vision for the future. But first, I want to learn a little bit about you
Sure.
and your path into medtech. What was it that drew you into the medtech industry?
It's a good question. I think there are a few things that drew me into the medtech industry. One is just the ability to make an impact.
Mm-hmm.
And if you think about having a profound impact on a patient life, saving, improving quality of life, or just transforming their life overall, the impact was something that initially drew me there. And then I think in addition, once you're in the industry, you really get to appreciate the level of innovation and the fast pace of innovation that happens and how that really fuels different treatment options and paradigms and being able to impact more patients. So that's really exciting. And then just the journey along the way. Once you're here, the journey is amazing. You're constantly finding ways to improve and innovate, but then also recognize that the journey never ends. It just continues on and on, which is exciting.
No, I bet. So what was your first entry point into the medtech industry? What was your first job?
So the first entry point into medtech industry was a little over 20 years ago when I joined Guidant Corporation.
Mm-hmm. Oh, boy. Okay.
So that was in their cardiac rhythm management division. So I joined that, and over the course of the 20 years that extended beyond there, I've focused in areas from cardiovascular to electrophysiology, to neurovascular and some other subspecialties. And then I've had the opportunity and the privilege to work abroad in places like Japan and in Europe within Germany. So a little bit of a global travel experience over the course of the 20 years.
Lots to unpack there, because Guidant is a culture that I always, when people come from Guidant, they have nothing but glowing things to say about the experience and about the imprint that it left on them professionally. I assume I can't get you to say something bad about Guidant.
Great place, great culture, and I would say, probably similarities between the culture here too. I think the culture here is extremely strong and very patient focused. That's great. Similar to when I first entered into the industry a couple decades ago. And
if you don't mind, I just want to unpack your time abroad. There's always a discussion as to how does that help you as a manager and as a worker to work abroad? I've heard that, for every 1 year you spend abroad, it's like 3 years in the U.S. because you really have to be focused and you really have to have your tight communication. You really have to have sort of a stronger, I don't want to say sense of purpose, but a stronger focus on what you're trying to accomplish. How would you, if you were talking to someone who's saying, hey, Wayne, I have an opportunity to go work in Japan, what would you tell them?
I think for the right person at the right time, I would highly recommend they seize that opportunity. Mm-hmm. For me, what drew me to those international opportunities was an ability to kind of stretch and get out of my comfort zone. Sure. And I think when you're in another culture, in another business, it certainly is, it comes without saying that you're going to be stretched and you're going to get out of your comfort zone. So that happened without question. And then in addition to that, just to being able to learn and absorb a different culture is extremely exciting, very rewarding, and I feel pretty honored and privileged to be able to do that. And then have an impact in a different way. So you learn a ton, you can hopefully impart some, so it's a give and take with the teams that you're working with. And then you get I think you can become a better global entrepreneurial leader also by just appreciating what happens in different cultures and how things work and how you can be successful in different cultures. And there's different subsets, populations of patients and things like that you can address too. So I certainly feel like I'm much more global minded when it comes back in terms of implementing, executing, and creating and collaborating with the different regions. I think I do it in a different way as a result of those experiences. So for me, I think as a leader, it was invaluable, and hopefully I can bring some unique things to the business by having those experiences.
That's great. I would love to go to a baseball game in Japan. They look like a lot of fun.
Those are a lot of fun as well.
That'd be great.
Very different, but awesome.
Well, that's a great journey to where you are today. Now let's talk about the task before you, the structural heart area. I'd like to just kind of give folks an overview of what structural heart is exactly, because we talk about the term and I throw it around half the time, not knowing half the time what exactly I'm saying. Give us a sense of how you view the structural heart space.
So I view it through the lens as the leader for the surgical structural heart business here at Edwards. So within surgical structural heart, we're working very closely with the cardiac surgeons, and they're performing different procedures on the patients that would address both open heart as well as minimally invasive surgical heart procedures. So anything from valve replacements to valve repair is our core business, but then within the general periphery of structural heart, there's many other areas that exist too.
Let's give us a sense of your products in the portfolio currently, and then we can talk about future products a little bit, products in clinical trials and things a little bit later in the interview.
Sure. So in terms of our portfolio right now, heart of our portfolio is our RESILIA portfolio. And RESILIA is our tissue technology that is on all of our valves right now within that RESILIA portfolio. So we've got surgical aortic valves, we've got surgical aortic valve plus conduits, we've got mitral valves now with our RESILIA portfolio. So we have our RESILIA Inspiris aortic product, we have our RESILIA mitral product, and then we also have our RESILIA Connect product, which is a aortic valve conduit. And then in addition to that, we've got different rings and other products for the valve repair.
And let's talk about the focus on structural heart and the spin out. What does that say about the structural heart space in where we are today?
Well, I think as Edwards, under the new leadership with Bernard, we're entering a new era of structural heart. And within surgical structural heart, we fit perfectly within that. We've always been a critical component of the Edwards businesses, and will continue to be that way moving forward in the future. So we're very excited about what that brings with this enhanced focus now on structural heart.
We'll take a quick break from my conversation for a short message from our sponsor, RESILIA.
So, Andy, I want to talk about the design and manufacturing challenges that have been associated with nitinol. But first, can you help us understand why companies use nitinol in these extremity applications?
So 99% of the medical device applications use the unique property of nitinol called superelasticity. So what this is it allows you to achieve really high strains over with constant force. So it's different than a conventional elastic plastic material where those strains are much lower and actually not recoverable. So for a suture passing application, for example, you want to follow a tortuous path, but you also want that device to spring back to its original shape afterward, right? For an implant, like a bone staple, you want to apply constant compression on the joint to allow it to heal faster, right? For bones to heal, they actually need compression. So that superelastic property allows us to insert that bone staple in by straining it and apply that constant force on that joint we're trying to fuse.
So let's now shift into the unique design and manufacturing challenges that are associated with nitinol devices. Can you help us understand that?
Number one is just understanding the superelastic properties, right? And how to achieve them, right? To get that performance in the device that you need. Comes along with that is heat treatments, right? To get those unique properties, you really need to understand the metallurgy and that link to the performance. Surface finishing is also very important. You need these devices to be biocompatible, right? So we've actually developed a lot of standard process flows over the years, and they've been optimized and proven again and again in order to help our customers get the ideal performance in their device. So we really are the leaders in the nitinol industry, and we really our goal is really to help our customers get their next generation nitinol devices to the market faster.
Well, great, Andy. Thank you so much for spending your time with us on the podcast, and we wish you the very best.
Thanks again, RESILIA, for sponsoring this episode of the Structural Heart Talks podcast. For more information about RESILIA, go to resinetics.com. Now let's resume my conversation with Edwards Lifesciences. Let's talk about the reorganization of Edwards and the focus on structural heart. What does that mean for your business?
It's a great question. And in terms of the decision with critical care, I think it's exciting. For critical care, it's also exciting for all the businesses at Edwards. It's really a win-win in my mind. What it allows is both companies that are going to be able to do greater focus on what they really want to do, focus more on innovation, focus more on fueling that innovation and doing remarkable things within the structural heart paradigm.
Excellent. Let's talk about innovation in structural heart. How is that done within your business? We'll talk with others who are working on innovation in other parts of Edwards. Let me know how it works internally, and I'd also love an understanding as to sort of how you interact with others at Edwards.
Sure.
If you do.
Yeah. So innovation is really our fuel. It's in our DNA here within surgical structural heart. We've been around for several decades, 65 years of innovation at structural heart. And that's really accomplished through, I think, a unique partnership, a trusted partnership that we have with the cardiac surgeon community out there. It's been in place for many years. It continues to build on that. And I think the combination of our partnerships with structural heart surgeons in combination with all of the deep expertise we have in our own buildings and walls here at Irvine and across the globe, with our engineers and strategists, give us a very unique combination and recipe that allows us to probably excel as a market leader within structural heart and surgical.
And where do the ideas for innovation come from primarily? You mentioned you're working with cardiac surgeons. I mean, they've always been a big part of the innovation process in structural heart and in heart valves. Does that continue going forward? I imagine it does to a degree. Is there a lot more internal going on? Just give me a little more insight on where the ideas will come from.
I wish there was an easy answer to that. I feel like the ideas can come from everywhere.
That's great.
We find many different mediums and forums to engage with our thought leaders across the globe, to engage with cardiac surgeons, to engage with the healthcare providers and the staff. And I think the combination of that gives us a better picture for where our needs met today, but also equally, if not more important, where are the unmet needs? And then how do we address those unmet needs, whether they're within the surgical procedures or then the disease states, or maybe it's geographically speaking, or maybe certain patient populations and segments have bigger unmet needs in certain geographies than others. So we kind of take the culmination of all that input and then work very closely with all of our experts within strategy and development and engineering to try to come up with how do we prioritize which unmet needs we're going after, and then how do we best serve those patient segments to ensure that patients that can be best treated with a surgical approach get access to the treatment that they deserve.
Give me a sense of the structural heart landscape. Edwards is focusing so much attention on this. It says to me that there's a lot of opportunity here, a lot of green space for you to move into, maybe a lot of new technologies that could come in and provide different solutions to a very real problem. How do you see the landscape looking out? What sort of green space do you see? Green space is the right term. And give us a sense of what's to come. What do you see happening?
Yeah, I think there's a couple of things that come into mind. First, there's a tremendous number of patients that are out there today that could receive treatment that aren't getting treated. So how do we best serve those patients and serve those unmet needs?
Sure.
We can do that through technology. We can also do that through different ways where we can bring technology or build awareness and educate folks and build capabilities to bring those technologies to certain geographies across the globe. So we're constantly looking at ways to innovate on the technology front, but then also try to address and uncover all of those patient unmet needs to deliver the best solutions to have the greatest impact to patients globally.
Mm-hmm. When you say technology, I'm just curious, is it the technologies that are currently in your portfolio, or do you see space for, and I'm not going to use AI, but do you see space for technologies that aren't currently part of structural heart to be part of structural heart in the near future?
I think those are all possibilities, the way I see it right now. So we're constantly innovating on our existing platforms and our existing technologies in ways that we can strive to get better outcomes, treat more patients, help transform lives in new ways moving forward. In addition to that, we're always looking at and assessing what other technologies could be part of our own technology, our own platform, or different ways we can expand it that would lead to better outcomes or better ways to serve more patients within surgical structural heart. So I think the sky's the limit. The question really is not, I think, if, it's more a question of when.
Okay. So let's take a look forward. What are you focusing on for the next 12 months at Edwards? And then I'd love to draw just your assessment of where structural heart is heading more broadly after that. But first, my 12-month question. What's coming up for Edwards?
Yeah, so with Edwards, I'll answer this from the surgical perspective. So within the surgical business and surgical structural heart, we will continue to be highly focused and laser focused on our RESILIA portfolio, our Inspiris and Connect aortic products, and our mitral product. This is where all of our emphasis and focus will be. We've got outstanding data that we're continuing to collect with our Commence aortic and Commence mitral trials. We released the 7-year results of that last year, and we're going to continue to follow these patients through 10 years. We're very excited and encouraged by the data that we've seen in terms of offering outstanding durability for patients with these products.
That's great. And then long term for structural heart, what does that look like in 5 years or so?
Well, I think what you'll see over the next 5 years and beyond within surgical structural heart as an industry and as a segment is the industry is going to continue to evolve and will evolve with the industry as it evolves. You know, one area that we've seen really come to light over the last several years has been the impact of what we are looking at in terms of bringing more patients into the system. These are patients that maybe were not captured in the system for assessment and evaluation for treatment options, and we're seeing that happen more. We think one of the things that's fueling that is there's been tremendous amount of investments in terms of awareness and education on the transcatheter technologies that are available, which is a different business unit here at Edwards. But we're getting a little bit of a halo effect, and patients are coming off the sidelines. They're being funneled into the system, and many of them are treated with transcatheter therapies, many of which who are better suited for surgical therapies. Maybe they're more complex patients. They have comorbidities. They have more complex disease states, and they will be best treated through a surgical approach, and we're getting those patients too. But it's great for patients because now they've got multiple options within the structural heart treatment paradigm.
Final question. This is an exciting time. I mean, you're at an established leader like Edwards, but you're reorganizing and you're almost starting a new business. This just professionally, how do you feel about the opportunity for yourself going forward and for Edwards with this new structure?
Very excited about the opportunity moving forward. I think surgical's in a great place, and the surgical structural heart business will continue to be a core component within the Edwards portfolio of businesses. Very excited about the growth opportunity. There's tremendous unmet needs out there that we're hot on the trail to try to resolve and solve for patients. We're going to continue to invest in innovation, which is very exciting, and we're continuing to explore and expand in the emerging markets area, which has been another growth driver for the business. So all things look positive. The industry is continuing to thrive. We're very fortunate, honored, and privileged to be part of that, and we feel a tremendous amount of responsibility and sense of urgency to continue to serve these patients that are best treated through surgical structural heart treatment options.
Fantastic. And thank you so much for joining us in the podcast.
Thank you. Enjoyed my time.
Well, that is a wrap. Thanks so much for joining us on this episode of the Structural Heart Talks podcast. Thanks to the folks at RESILIA for sponsoring this episode and making it possible. Of course, thank you to the executives at Edwards Lifesciences who made themselves available for these interviews. You can follow this on our Device Talks podcast network. Subscribe to that. You can also check out these interviews in a video format on YouTube. We're working on more episodes of the Structural Heart Talks podcast for you, so make sure you're a subscriber and don't miss a future episode. Thanks, everybody.